So it is the Pediatric Intensive Care Unit of the Szent Laszlo Hospital. It is the leading infectious sanctuary in Hungary. We began to work 21 years ago, and it is a sanctuary for infectious diseases, sepsis, and we have the largest bone marrow transplantation unit for children and adults in Hungary, so we treat a lot of kids with bone marrow transplantation if intensive care is necessary. We have a good monitoring system. We can see the monitors in the transplant ward and in the other part of the building. They have two places, and we work together. And the monitoring with USCOM. It is the first step. So we transform the pediatric hemodynamic guideline. The first step in the first 5 minutes is the USCOM, and if we see the results, we can decide what to do.
How long have you been using USCOM?
4 years.
Uh-huh. And how do you use it?
Regularly, on daily basis.
Yeah.
And it changed our practice. We use much more noradrenaline than before, as it is a trend in pediatric septic shock therapy worldwide.
Mm-hmm. You find
so
it simple?
We use it, and we like it. We love it.
You're using it too, Peter?
Yes, absolutely. This is my favorite device on this ICU.
You're the editor of this, are you?
Yes. And this book is on the 3rd place of the top 5 in the Medicina kiadó publisher.
Book publisher.
And USCOM's in there?
Here. See.
And that's me performing an examination.
Yes. TV star. The TV star, you know.
So this is a routine part of what you recommend
Yes,
for clinical
yes.
practice?
And here it is invasive meningococcal disease, 2 types of hemodynamic patterns. It here, the SVRE 250, and here 2238 vasoconstriction and vasodilatation. The therapy is not the same, so we have to do something.
So how did you buy the USCOM?
First, I saw it on a congress, in the annual congress for pediatric anesthesia and intensive care. And before there were a lot of offers how to use other monitors. I went there, it was nice with the waves, and I asked, may I try it out? I put the head, put on the patient, and it was perfect. They said, of course, it is not so easy to everybody, but you have such a huge practice in using the ultrasound. And I said, yes, it was my first time, so I buy it. Okay, what's the price?
Yesterday, he's in a very critical condition. He was admitted with severe cardiac failure, and it turned out that he had some very severe vasoconstrictive difficulties, which was affecting the circulatory of the circulatory system of the lung, and it seems that the patient has some kind of myocardial failure based on myocarditis, probably based on a viral infection. And it took a lot of time to figure out which vasoactive treatment or inotropes treatment he needs, and the USCOM was one of the most important devices I was using the whole night to figure out which is the best for the patient. And he is still in a severe condition, but it seems that he might have some reserve, and we can use that to, with the help of the USCOM, to get him in a better shape.
The USCOM is very easy to learn, so even the youngest physicians can use it, and it is easy to teach the physicians how to think and how to improve the cardiac support of the patient. It is the pediatric block of the St. Laszlo hospital, and on the first floor you can find a pediatric intensive care unit. We work there.